Hey everybody, it's Joel here at Vintage Fitness down here in the cavern. I'm going to talk to you a little bit more about hip health and hip rehab. Get a lot of complaints about especially pinching and pain in the groin, or it feels like, as people flex and try to do athletic stuff, that there's a catching or an impedance there in the groin area. So today we're going to go over a few things. I'm going to start just by saying, if you're somebody who gets a lot of groin, hip flexor tightness, tension, and you have been knocking yourself out, stretching, and they just still always feel tight, then perhaps the problem is less that they're tight and more that they're weak. There's a few simple tests that somebody can help you out with just to see if you've got some weakness. A simple one, got this one from my buddy Trev at Smashworks. A really great tool is to do your own self-assessment. Basically stand on one foot, flex your knee up, let your hands off your knee. If you can't hold that knee above the parallel position for 20 to 30 seconds or so, then you probably have a weakness. If you pull that knee up and you let go and your leg wants to drop and give, then you probably have a hip flexor weakness. So anyway, we're gonna work on a few things. I'm gonna show you a simple way to do some hip setting using a band, try to help open up that hip joint on your own, and then a couple different versions of strengthening the hip. We're gonna work on the hip flexor. We're gonna work on some hip abduction. A lot of times we have weakness in the outer side of the hip, throws things off in that hip and allows the hip to grind and bind up. And we're gonna do a little bit of adductor work as well. And I'm gonna be back to show you all those in just a moment, but that's where we're starting. So check back, we'll be right back. All right, so first thing I'm gonna show you is how to do some hip setting. A lot of times what happens, the hip is a ball and socket joint. The ball part presses, gets jammed up into the socket part, the acetabulum, right? And then that restricts its ability to flex and rotate. Remember, the hip, much like the shoulder, has a lot of planes of movement. It's a ball and socket. It's supposed to be able to move in multiple directions. Once that binds up, that gets hard to do, okay? So what we want to try to do is decompress, open up that joint a little bit, maybe try to pull that femur head a little bit out of that acetabulum and actually posterior. Often what happens is the head of the femur jams forward in the hip, jams this way, so it pinches, especially up against some of that soft tissue in the groin, and gives you a lot of trouble. So here's how we do hip setting using a band. First thing, you want to just use a band that's got a fair amount of resistance. You don't want to use a real light one for this one. You do have to use one that's a little bit heavier. So, something a little thicker. Secondly, you want to attach it. Mine's clipped into a carabiner at the bottom of the rack here, but you can just loop it around the leg of the rack. Clip it, adjust it, tie it to something sturdy. Don't put it around the leg of a kitchen table that's going to drag across the room, because you're going to be throwing your body weight into it. So you need something that's pretty secure, okay? So find a beam or a heavy piece of furniture, like a couch maybe, and loop it around the end. And then you're going to use this like a stirrup. You're going to step through like you're stepping through pants. Pull the band up high into your groin, right up high into the crotch, okay? Then what you're gonna do is you're gonna get as much tension as you feel like you can handle without feeling like the band's gonna pull you into a wall, okay? And you're gonna go down, kneel on the knee that coincides with the band, okay? So we're gonna kneel on that right knee. From here, we're gonna spend 2 minutes just sort of wiggling around and wriggling that hip. So I like to rock. I will actually set my 30-second gym boss for 30 seconds. I like to do 30 seconds straight on, and I just rock forward and back. You can even get some circles. So you see, we are actually doing sort of a hip flexor stretch, but we're also decompressing at the same time. The timer goes off, I hear that beep, 30 seconds is over. Then what I like to do is turn a little sideways here and rock side to side a little more. Just pulls on that a little different angle, helps to kind of pull that hip out of that acetabulum, okay? So then the timer will go off again. That's 1 minute total, right? I'll go one more time, one more 30-second interval here, and work and try to just gently, and I'm not trying to kill it. I'm just gently working. Maybe I'll go down and hit it a little deeper, okay? Okay. Beeps one more time. We go one more time this way. Sometimes I even like to take this back foot and turn the toes out slightly. Rotates that hip a little bit more, okay? And that's oftentimes a restricted plane of movement for people. And after 2 minutes, back out slowly. Be careful because you don't want the band to slam you into the weight rack, okay? And come on up. Switch, 2 minutes on the other side. I like to do this at the end. I like this to be the last thing I do. I've got some buddies like to do it as a precursor to things like squatting and leg day, just to loosen up and open that hip. That's fine, but as a rehab tool, I like to do all the work, all the strengthening, and then do the hip setting at the very end. It feels really good. You'd be surprised. You won't feel it so much while you're doing it. It might be a little uncomfortable, but afterwards, boy, it just feels like it lightens up that joint for you. If you start doing this at least 3 or 4 times a week, you start to feel that maybe that hip starts to open up and you start to get some mobility back. All right, let's go on to some strengthening. All right, let's move on to some strengthening work. And before we even get started, again, big shout out to Trevor at Smashworks. Go check him out. His Instagram is awesome. The dude is super clever, super creative, has great advice, a lot of great ways for you to treat your own injuries at home. He's a great resource. Smashworks, go check him out. We're gonna work, I got this particular exercise from Trevor, and I've been using it myself, working on my own hip issues. And so I wanna show it to you. This is a great way to start strengthening the hip flexor or iliopsoas muscle group. And so this is how we do it. We're gonna go down on a knee. The leg we're working is the upside, not the one we're kneeling on, the upside. Use a foam roller. You know, you could use a kettlebell. You want something just around for some balance. You could use a body bar if you want. Something just to give you a little balance, because I'm going to tell you in the beginning, you're going to feel sort of tippy and awkward. So you're going to want something. So I keep my foam roller handy. What we do is with that front leg, we're just going to work on trying to raise the foot up off the floor, hold it for just a second or two, touch the floor, raise it. The idea is we're trying not to necessarily rest at the bottom, take a big rest. You're just trying to touch and go, right? So raise, touch, raise, touch, raise, okay? 10 reps one side, switch it around, 10 reps the other, raise, touch, raise, touch, raise. As you get better, if you want to try to do it without the balance tool, raise, touch, raise. It's tough. It's harder than it looks. 3 sets, 10 reps each. I don't take big rests. I'll do 10 reps on one side, go right to 10 reps on the opposite side. My feeling is while I'm working this side, the other side's getting a rest. So I just go right back to it. It's time efficient, it's quick, it's pretty effective. So start adding this one into your hip exercise routine. All right, let's move on to the next. We're going to work are the lateral stabilizers of the hip. So if one link in the chain is weak, the whole chain becomes weak, right? So even if you're getting a lot of groin pain, it doesn't necessarily mean that the only problem is your groin. Sometimes there are imbalances in other areas that might give you trouble. So you want to hit those areas up, try to strengthen those. As everything gets stronger and everything works in concert together like it's supposed to, then the joint will start to feel healthier, stronger, better. So we're going to work the lateral stabilizers. Very simple. You guys probably all know this one. We're going to use a simple side plank, but we're going to do it in a pulsed fashion. keep in mind, the lateral stabilizer you're working is the one on the bottom. So we're gonna do it much like the hip flexor exercise, sets of 10, 3 sets of 10. We'll just go boom, 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 one side to the next. So here's how this one works. We're in that classic side plank position. We're gonna stay in the low plank, so use your forearm. If you have to, you can use your other hand here as an assistance device. And all you're gonna do is bump that hip up off the floor, touch, bump again. I like to put my arm here. It doesn't really matter. You can put it here on your hip, touch, go. Try not to take a big rest at the bottom. If you have to, use your free hand here to help give you a little push or a little balance. What we're gonna do is sets of 10. At the top, squeeze and lock it in. Squeeze your butt tight, squeeze your abs tight. Just a pause, touch, go. Touch, go. 10 of those. When you're done, roll right to the next side, the other side, and boom, touch, go. 10 of those. Boom, just like that. That's your lateral stabilizers. You're done with that one. Perfect. Hang in. Oh, so just to be clear, right? 3 sets of 10. Again, rapid fire, pretty much. Right, left, right, left, right, left. Okay, 3 sets of 10. Moving on. All right, so we've done the hip flexor, lateral stabilizers. We're gonna hit the inside of the thigh, the adductors. I'm gonna show you one way using the step-up box. You could use something else. I've used a medicine ball before, an ottoman in somebody's living room. You know, that would work. Again, this is one of Trevor's suggestions. I'm going to show you an alternate way, another way of doing things using a band. But the first one is with the step-up box, or something that gets you a little bit up off the floor. So again, we're going to go in that side plank position. You can use the other hand for stability if that side plank position is tough. Again, the work is being done this time by the leg that's on the box. So one leg's gonna be on the box, one will be off the box. So the one that's on the box is actually the one that's doing the work. I'm gonna have you do it in a post fashion, just like that last side plank exercise. And we'll do 10 reps on the right, 10 reps on the left, 3 sets. You're done with that one. So here's how you do it on the box. So we're gonna go in that side plank position. Again, the top leg is now the leg we're exercising. We're gonna put it in step down on the box. Here's your side plank position. I just stick that foot, I just stick it right there out of my way. And we are now planking here using that adductor. And what we do is we can pulse it, touch, go. 10 reps, touch, go. If you need to, you can use this hand to give you a little extra support. In the beginning, you may need it, okay? So again, we'll do 10 reps one side, 10 on the other, 3 times through. Take whatever you need for a rest, but because you're working one side at a time, as you work one side, the other one's resting, so you don't need long breaks in between. Myself personally, time is always a factor for me, so I a lot of times just go boom, 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 boom. Rapid fire, one to the next, without a lot of breaks. Take my bigger rests between the exercises. So, just a suggestion. All right, I'm gonna pull that box out. Another way is with a band. And again, you gotta tie that band on to something sturdy, okay? Here's just on one of my racks. Put your foot in the band. I just put it right around my ankle. Laying back. And now we're going in sort of a diagonal pattern. I like to bring it almost towards the opposite shoulder. So I'm working the right leg, bringing it this direction. So almost towards my left shoulder. Gonna work that adductor. Gonna get some psoas work in there as well. Don't let the band snap you. Keep it under control. This exercise, you don't need a heavy band. This is just a classic red band, a medium band. And again, 10 this way, and then you would do 10 on the other side, 3 sets. So there's your adductor. So we've done the hip flexor, we've done the lateral stabilizers, the inner stabilizers. We're gonna do one more exercise here. I'm gonna show you a glute exercise, a very simple one. We're gonna do it just on the floor for this one. This is a single leg pulse bridge. Guys have probably done pulse bridges a bunch of times before. Here we're just gonna work single leg, working on strengthening the glutes as well. I like to just point the opposite leg straight up. It's sort of my target. I sort of try to touch it to the ceiling if you kind of envision that. The exercised leg is the one that's on the floor, obviously, okay? So all we're gonna do here is pulse up. You don't have to overextend. Again, trying not to actually rest right on the floor. We just wanna sort of touch and go. You don't even need, you can do this with resistance if you want, but even just as a body weight activity, this is a great exercise. We'll do 10 on the right, 10 on the left. How many times through? 3. So there you go. That's a hip routine you can easily incorporate into your workout routine to help. If you're having a lot of that groin pain or binding in the groin or hip flexor, if you think you've got a hip flexor tightness and you've been knocking yourself out trying to stretch it for days, weeks, months, years maybe, and it just doesn't ever seem to let go, maybe what we need to do is actually strengthen the overall hip joint. Now listen, I'd love to tell you this is gonna happen in 2 or 3 weeks. It's not. Nothing ever does. And especially the older we get, the longer things take. So you got to be patient. Maybe if you're having problems like this, throw this routine in 2, maximum maybe 3 times a week. I wouldn't do it much more than that on top of your other workouts. Throw it in 2 to 3 times a week and give yourself a good 90 to 120 days anyway. So you're talking 3 to 6 months, right? To see if you're starting to make progress. I think you've noticed that you will, okay? So give it a try. Dedicate a little bit of this to yourself. Work on that hip. Let me know what happens. Check back. We've got some other hip videos on my channel. You can check those out as well. But been running into a lot of people with hip flexor issues, and I wanted to just kind of deal with that directly. So remember, do the workout first. I would do the hip setting at the end. Bang, bang, boom, done. Move on with your day. Go be productive. Hey, I'm Joel. This is Vintage Fitness. We're down here in the cavern, and hopefully this helps you out. Check back for some other videos. Thanks, gang. Life is heavy. Train for life.